production, milk production, and growth. So if you are a producer expecting to achieve maximum profit from your goats, you need to be able to perform a level of preventive medical treatment on your animals. Your veterinarian is not just a vet, but a good resource person from whom you can learn about the preventive health care of your animals. Dr. Paul Cadogan is Secretary of the Jamaica Veterinary Medical Association. Let's now observe the process of how to check the goat's temperature as well as its pulse and heartbeat.
Taking the temperature of the goat can be done with a simple thermometer, a rectal thermometer, or you can get the usual ones with mercury that you have to read, or you can get the electronic ones where you put it in there and when it's ready it beeps and it gives you the reading. With the mercury thermometer you have to shake it down to make sure the mercury has gone down below the temperature range. If you move the thermometer back and forth like that, you can actually see where the level of the mercury is. Now the normal temperature of a goat is going to be between 102 and 104. If it's above 104, that animal has a fever. If it's below 102, sometimes that indicates that they have a serious condition and they are in peril. They might be dehydrated, they might be weak. That means they are hypothermic. And then we insert it very, very carefully into the anus of the goat. And it's left there for about a minute. And if they are panting, breathing hard, that suggests that something may be wrong. It doesn't necessarily mean that they have a respiratory infection. It can just be the stress of whatever they're going through. They might be in pain, etc. Or you can take the pulse by feeling for the femoral artery, which is up underneath the leg. You have to kind of just put your hand there and just stay very quiet, and eventually you'll feel a little pulse going boop, boop, as the blood flows through. So your fingers just go right up on the leg and just rest them against the inside of the leg, and you will feel that beat, that pulse beat.
If goat producers are ever going to establish broad and stable market demand for their products, then raising a better goat must be the focal point of the plan.
First thing, we can look at the overall condition of the animal. We can look at you can see the hair coat is nice and smooth. No evidence of hair loss or any injuries. The animal is also in good body condition. You can and see that you can't see the ribs. You can just feel them. That's perfect. You can't really see any of the bones of the spine. The hip bones are not prominent. This animal is in pretty good body condition. So then once you have established that, given a once over, then you can start at the head. Of course, you look in the nose. You look for any nasal discharge. This one has some little clear mucus coming down. I wouldn't say that's a big problem. It's when that mucus is white or yellow or kind of pussy looking, that can indicate that there may be a respiratory infection or nasal worms, estrus ovis. And the animal can sneeze sometimes and you see this heavy discharge coming down. Right? You can look in the mouth, you can examine the teeth. You can actually open the mouth and you can see the tongue, you can see some of the back teeth, and you also look at the gums. Right? The gums can tell you that the color of the gums. You can squeeze it, see that the circulation is good. Because when you squeeze it and it gets pink quickly, that's good circulation. It's nice and pink. That's an indicator that animal might be in generally good health. You can move to the eyes now, and this is a very, very important one. This is a very quick way of telling in these animals whether they may be anemic or not. You pull down that lower eyelid and again look at the membranes in there, and you see that's nice and pink. That is an indicator that the animal probably has a very, very good blood count.
Many times a health concern is discovered when you are grooming your goat. You can uncover weight problems. Is your goat too fat or too thin? You can also detect parasite infestations such as lice or skin diseases, ringworm or mange, also those wounds that could become infected or abscessed. Which brings us to the routine deworming. So you shouldn't wait until your animal is losing weight, has pale and sunken eyes, and is passing soft feces to deworm. You should note, however, that the problem of resistance to worm medicines can develop.
And if you are just deworming routinely, you're taking worm medicine and you take your entire herd and you deworm them, say, once a month as a routine, no wormer will kill 100% of the worms present. You'll always have a small number that will survive, and these are resistant worms. Now, if you keep giving the same worm medicine, you're giving it over and over and over again, over a period of time, you're killing off the susceptible worms, and the resistant ones are surviving and increasing in number. But any animal that looks pale or almost white, those animals need to be dewormed immediately. And so what that means is that you have to examine your animals on an individual basis. So periodically you go through, look at everybody, look at their membranes. If the membranes are pink, you don't deworm those. If they are starting to get pale, beyond, going to stage 4 or stage 5, or total whiteness, those animals need to be dewormed.
One of the important tools for determining the worm status is a fecal examination.
And what we need is a fresh sample of feces, either collected directly from the animal, or that the animal has just passed. We can't use feces that's been on the ground for a day or so, because what happens is that the worm eggs that are in it will hatch out. So what we want is that sample of feces, and we bring it to the veterinary clinic and we examine it to see if the worm eggs are present and see what kind of numbers are present. And that can be done very quickly and easily. And if you say you have dewormed your animals, and 4 or 5 days later you collect some fecal samples, bring them to the vet can examine them, we'll be able to see whether there are in fact worm eggs still there, or if the worm eggs are gone. A good way of doing it is to take samples before you deworm and then after.
Controlling the internal parasites is a very complex issue, which goes beyond just worm medicine. There's no quick fix, hence the need for caution.
There are so many factors involved. Apart from using the worm medicines, the goats are under a constant threat of reinfestation. If you clear out the worms and they go back on the pasture or the areas where they are grazing, where the worms are still present, the worm larvae are there, they're going to pick them back up again very, very quickly, and within a couple of weeks, they have a new population inside. So it's one of the issues that really faces Jamaican goat farmers, in that many of them are small households and the animals go out to graze and they graze in the same place every time. And you worm them out, you send them out in the morning, they go and graze and they come back. And when they go out there and graze, they pick back up the worms. Get these lesions, these little sores that form around the edges of the mouth, and they get scabby, they can get sore, it can be very painful. Sometimes it's caused by a virus, but they can get infected with bacteria and you end up with a big swelling under here. Sometimes in unusual cases they can spread to other locations on the mother of the goat. The lesions can be on the nipples, on the teats, and they can also occur on the feet as well. This is not foot and mouth disease. It's a very, very, for the most part, not too bad for the animals. It will get better and they will heal up. All you need to do really is dress these lesions with some gentian violet, or if you have one of the antibiotic sprays like the oxytetracycline and gentian violet spray.
Here is a list of some common problems affecting goat farmers in Jamaica.